It is noon, and we are live here on Facebook to Ask the Expert. All right. Good afternoon. I'm Deanne Marasco, and we're excited to have you today. As you know, in this unusual time, we find the places that we can share information. And so today unfortunately am sharing through my car, but we're excited to share and talk to Dr. Steen today. So without further ado, I'm going to get started, and we look forward to having you all here today. So thank you for joining us on our monthly Ask the Expert Facebook Live event. My name is Deanne Marasco, and I'm the Health System Director for the state of Florida for the Alzheimer's Association. Ask the Expert is through our virtual Brain Bus program, which is sponsored in part by the state of Florida's Department of Elder Affairs and the Area Agency on Aging for Pasco and Pinellas. So I want to ask where everybody is calling in from today or reaching out to us live here on Facebook. If you want to put where you're coming from, that would be great. What city? And we did ask for questions to be submitted prior to the event, and we'll be answering them during the Q&A. We'll also try to answer live questions, and you can place those questions in the comment section. If we can't read all of the questions live, then we'll respond to your comments via Facebook event. Today, we're very fortunate. We have a special guest, Dr. Susan Steen, who will be discussing cognitive assessments. Dr. Steen graduated from Florida State University with a BS in biology and chemistry. She graduated from the University of Florida's College of Medicine and completed 2 years of internal medicine residency at the University at the University of South Florida affiliated hospitals. She did her residency in neurology at the University of Florida's College of Medicine. Dr. Steen is a general neurologist and sees adult patients with many types of neurological illnesses. She's particularly interested in dementia-related diseases and memory loss. She serves as the president of Axiom's Clinical Research in Florida and oversees many studies of medicines in development of neurological conditions, especially Alzheimer's disease and related disorders. Dr. Steen also serves as board of directors for the Florida Gulf Coast chapter of the Alzheimer's Association. And it's now my honor to welcome Dr. Susan Steen. Welcome, Dr. Steen.
Hi, Deanne. Good to see you.
Good to see you. We're so glad to have you. So I'm just going to really go right into asking some questions because today we're talking about cognitive assessments. So I'm going to put it into 2 parts. Can you tell us about cognitive assessments and who needs one and what does it measure?
Okay, sure. So a cognitive assessment can be one of many different types of assessments, but basically we're looking at how the brain is processing information and whether or not there might be a problem there that might be out of the range of normal. So people who need cognitive assessments are really, anybody with a brain, but particularly those folks of us who have brains that might be at somewhat risk of maybe developing some problems with our cognition. So we start testing folks who, first of all, who have any concern, no matter how old they are. If they have a concern or their loved one has a concern. We also do cognitive assessments routinely for folks who are 65 and older. So that's part of the Medicare general wellness examination that should be done annually by people's family care or primary care provider. And sometimes that doesn't get done. Many times that doesn't get done for various reasons because the patient has multiple medical problems and there just isn't enough time or attention is on other things. But that should be part of a yearly examination for all of us that are 65 years and older. So cognitive evaluation could be something as simple as tell me the date and remember 3 words, or one of the mini cog that I like to teach my colleagues to do is remembering 3 words and then asking them the 3 words again in maybe 5 minutes, and drawing a clock and putting the hands on the clock to say a certain time. And so that very brief exam can tell us a lot of information about people's ability to process information and to recall things.
So what you're sharing is really that cognitive assessment and it being an annual wellness, part of the Medicare annual wellness visit. So really it needs to be included on, when they're doing baseline for cholesterol or blood pressure on that annual evaluation. And if they're not receiving it, or if they haven't heard those questions, like you said, to retrace those 3 words, or maybe a cognitive assessment, that it's important for them to ask, because it is a part of that. And it is a screening, right? So it's really a screening tool versus that diagnostic. So we want to be able to do that, on an annual basis.
That's right.
You mentioned primary care. So, and we said, it really needs to be on an annual basis. But from your perspective, by whom do you see that happening? So you mentioned primary care. Could it be somebody else that's providing that cognitive assessment?
Well, sure. I mean, any healthcare provider can do that, but you don't have to be a doctor to do a cognitive assessment. And sometimes you'll see, opportunities to have cognition tested. For instance, in our Axiom, we do cognitive assessments for free. I mean, people can sign up to come in and we usually do a mini mental state exam, which is a test that takes about 10 minutes, testing orientation, and again, the 3 words, and doing some mathematics and drawing intersecting pentagons. And that very brief exam can give us a lot of information. So I will say, Deanne, that your point about if the cognitive assessment is not done, and particularly, and even if not so, the person is concerned, or their family is concerned about a memory issue, I would encourage folks to bring that up to their healthcare provider, whether it's their nurse practitioner or their PA, and ask for that to be done. And if there's no time during that visit, then schedule another visit and come in and get it done.
Yeah, and one of the things that I share, especially when talking to the community, whether it's primary care or patients, is the real understanding of the importance of what I call that baseline. So where do you sit at this moment? So what is your norm at this moment? And I think that's why that cognitive assessment being done, not just annually, but if you notice a change in your memory thinking, how that's important. So would you mind just sharing a little bit about why and what does it mean with a baseline perspective?
Yeah, so a baseline is important, and a cognitive assessment is one part of looking at people's ability to think and solve problems and have persistent, good memory, recollection, and so forth. So a big part of this too is the history, is the story of what a patient or person perceives, and the story of what their loved ones perceive. Because many times folks who have even mild cognitive impairment don't really realize that they've got an issue, and that may be an issue or may not. It may be part of normal aging, for example. I mean, with normal aging, we tend not to remember names of people or names of movies or names of things, but then the issue can become more impactful and potentially a serious problem. So we need to be perceptive and receptive to folks' story. I'm concerned about mother, or I'm concerned about whoever. And when you say that to a healthcare provider, the antennas need to go up, and the provider then, hopefully, if not already, will do a cognitive assessment, which, like I said, can be a mini mental state exam, could be a Montreal cognitive assessment exam, could be this mini cog. But it is important to, I think, like you said, have a baseline and see if there is a change in the cognitive assessment, as well as the story of what's going on at home. What are people capable of doing? and is there a problem with the checkbook or whatever?
Yes, so really patient-centered, knowing the story and having a baseline to really determine. So you need to know the whole story of what is going on really with their memory and thinking. No, I appreciate that. So I'd like to ask you a question about research. How is research working to advance the future of cognitive assessments?
Sure. So research is multifaceted. Right now, we have 4 approved medications for the treatment, the symptomatic treatment of Alzheimer's disease, say. And some of those medicines are used in other types of degenerative dementias. They are of limited value, but we use them. So what research is really looking at now, and has for the past decade, is looking for what we call disease-modifying therapies. And so these are medicines or devices, most of them are medicines, that we believe will change or significantly alter the course of the disease by significantly slowing down disability and cognitive decline.
And so, really with the research, we've got treatment, and then I know we have something coming in the future, or this treating the symptoms, but coming in the future with another medication coming out. So I didn't know if you could talk a little bit about what your role has been from a clinical research standpoint, and what we see hopefully happening in the spring.
Sure. So I've been a principal investigator, so I'm in charge of the trials that are done at Axiom Clinical Research here in Tampa. And so we partner with pharmaceutical companies or with government agencies to look at medications that may improve symptoms or may importantly stabilize symptoms. And so these trials involve human volunteers. They are scientifically based, so all trials have a placebo arm, and some people are on placebo and some people are on medicine, but nobody knows what you're on because everybody's blinded to keep the trial scientifically valid. And then through several phase 1, phase 2, and importantly phase 3 trials, if there looks to be efficacy, if it looks like the medicine works, and very, very importantly, if the medicine is safe, then those trials are presented to the FDA. So at this time, we do have a compound sitting in front of the FDA. It has not received approval yet, and we're not absolutely certain it will receive approval, but we hope that it will. This is a disease-modifying agent that alters the deposition of a protein called amyloid in the brain, which is a bad actor, we believe, in Alzheimer's disease. So we're excited to see what happens.
Well, thank you. And so again, just kind of going back to the cognitive assessment, it's important to have done on an annual basis. It is part of that Medicare annual wellness visit. So I always like to say, as a patient advocate, anybody that's listening, if you haven't had your memory or thinking checked, this is a great opportunity to have that conversation, and especially at that annual visit. So I'd like to open it now, if you don't mind, to asking the audience if they have any questions, and maybe taking a few questions. We're going to do the best to answer those questions today, but always keep in mind, if we're not able to answer those questions, you are more than welcome to call our helpline, and I'll be sharing at the end that phone number, and we'll also put it into the comments. So I'm just going to see if there might be any questions. Okay, so we actually have one right here. So Dr. Steen, why does my husband get words mixed up? I correct him time and time again, and he still does it. Should I worry?
Okay, great question. So language and the disturbance of language can be part of obviously a brain disorder. It can be part of a structural brain disorder. So we can see that in the involvement usually of the left temporal lobe, in someone who's had a stroke or may have some kind of a tumor. But we see it also in degenerative disease. So language, when people have a disturbance of language, we call that aphasia. So there is an aphasic variant of Alzheimer's disease where there is a significant amount of problems with word finding and language. There is another type of a degenerative dementia, which is a type of frontotemporal dementia, where people can develop what we call primary progressive aphasia. And so with that disease, people have significant problems with their language, out of proportion really to the problems that they have with memory. So I think it's very important to get that addressed.
Absolutely. Thank you. And let me see if there's any. Okay, we have another one. So when I go to visit my dad, who's been diagnosed, he just won't talk to me. I ask him lots of questions and he just stares at me. We were always very close. So why won't he talk to me?
So that's another great question. And part of this disease of Alzheimer's is being withdrawn, being apathetic, and losing the ability to communicate. And so there are techniques that we use, and the Alzheimer's Association has a wonderful little pamphlet on communication for people who have dementia, which helps the companions and the caregivers, gives them some guidelines on how to approach folks with the disease and be able to more effectively communicate with eye contact and with keeping things simple and with not too many questions, but just sitting on the bench, just being with folks, just touching them, just communicating the best way you can. And it doesn't always have to be with language. But this is a journey, and it's a journey for the caregiver in regards to becoming educated as to how to deal with these things. And so I would really encourage that person to reach out to the Alzheimer's Association and get some clues and tips. And also, let me just put in a plug here, and maybe we're going to talk about this in a minute, but find out in your community, and you don't really even need to be in your community to participate in a caregiver support group. So that you can link into that virtually now, of course. And there's a fund of knowledge that people can obtain from communicating with other people who have gone through this and are going through this journey.
Absolutely. And having just some common ground where people can understand and be there. So yeah, absolutely. And what you mentioned, not just with our communication, we have our virtual brain bus education and the programs we offer there. And I'll be providing the 800 number, and it will stream in just a moment as well so that everybody can get that. So a couple more questions coming in. I feel like I should be saying this myself too, and I know that it'll be common, ground for many. So I've have a hard time remembering names. Should I be worried?
Another great question. And that's a question that I get asked multiple times a week, and not just from my patients, but from my friends. But so as I kind of alluded to earlier, this coming up with names is a very common phenomena that occurs with normal aging. And people start usually noticing it and complaining about it, usually after the age of 50. And that's no line in the sand, but as we approach those years, it's more of a timing thing. So it's on the tip of your tongue, and you know that person, and then like for me, I do the A B C D E F. Oh yeah, Frank. And then it comes, and so that can be perfectly normal, a normal part, but a very frustrating part of aging. So I wouldn't be too awfully worried about that, but it's something to of course, bring up with your healthcare provider.
Absolutely. And so I have another question here. Cognitive assessment changes over the course of a day in my wife. Morning is best, evening is worse. How do you assess when it's always changing?
Yeah, sure. And that's so true. And your story there about morning is best and evening is worse is pretty typical. And so many of us here have heard the word sundowning. And so sundowning doesn't always come when the sun is down, but usually at the end of the day, 3, 4, 5 o'clock, people are tired, and they just they're not doing as well. as they do in the morning. So that's pretty typical. And so we take that into consideration when people come into the clinic and it's 4 o'clock in the afternoon, or they've, just driven, 50 miles in terrible traffic. And so the situation and how we assess cognition certainly takes that into consideration.
Absolutely. And then one of the last statements really from Francine, and I hope I'm saying your name correctly, is over time, it's very difficult to determine if it's getting worse. So I think it kind of goes back to having that diagnostic assessment and really noticing the difference in the times of day. So can you share or elaborate a little bit more, with the statement of over time, it's very difficult to determine if it's getting worse, is the statement that she's made.
Sure. So, and I guess it depends on the time. Alzheimer's disease and many of the degenerative dementias can take many, many years to progress. And that's particularly true in the early stages, in the mild and then in the moderate stages. People can go for months and sometimes, years if they have good nutrition, if they're exercising, if they're in good health, if they don't have medication complications, they can go for a while and may fluctuate from through the time of the day, like I said. But this is a slowly progressive degenerative problem. And the other thing that's important, and as I said, is understanding from the caregivers what's happening at home. So we're interested in activities of daily living. Can people make coffee? Can they manage their medicines? Do they need assistance picking out their clothes, or with hygiene, or with shaving, or these kind of things are very important for us to know about.
So not only coming in and saying there's concern with the memory and thinking, but really looking at how they're able to live independently.
Right.
And
exactly.
if assistance is needed.
Exactly.
Okay. So I have a couple more questions that are coming in. We have a few more minutes. So I'm going to keep asking you, Dr. Steen.
Okay, great.
So my mom lives with us and she asks the same question over and over. One time she asked the same thing 8 times in 10 minutes because I was counting, and I'm at my wit's end with this. What can I do?
Okay, these are such great questions, and this is reality. And so the caregiver is in a tough place, and this story of repeating because mom doesn't remember that she's already asked that, or you've already told her the appointment is 2 o'clock and what time is the appointment. And it gets very frustrating for the caregiver to the point that folks are, have a tendency to get not frustrated, but angry and say, Mom, I already told you that. Don't you remember? I already told you that, not a good idea, because she doesn't remember, and it's not her fault that she doesn't remember. So again, I think being educated, having the ability to communicate with other caregivers and understand what they do, having the opportunity, if possible, to step away and get yourself together and go shopping or go to a movie. I mean, that may seem far-fetched, but we need to try it. We can't go to movies now, but take a walk. Find some release and know that that's okay. You have to do that. We always say that being a caregiver is like being on an airplane with a child, and you put your mask on first and then you put the mask on the child, because you've got to take care of yourself. And a lot of that is mental health and attitude, and again, understanding that this is a very frustrating situation, and just kind of learning ways to cope.
Absolutely. And I think, some of the things that I've shared in the past when, working with caregivers is it's difficult to realize that we can't really change their behavior, but how do we assess and modify our own behavior? And part of that is through that self-care, like you said. Absolutely. So we have a couple more questions. One thing I do want to just share with you is we're so grateful to everybody being on here today. For us to know how we're doing, we've put into the chat a survey that we really ask that you go to it and answer those questions. So you'll see that link. We do what we do because of the feedback of our constituents. And so please go and fill that out. We would be so, so grateful. So just click on that and put that into the notes and maybe come back to it and stay focused, listening in. But we ask that you do that today. So a couple more questions and then we're going to wrap it up. My mental acuity is great, but my short-term memory is terrible. Can this be dementia or normal aging?
Okay. So I just want to do a quick definition of dementia. So dementia means that people have lost cognitive ability to the extent that they cannot live independently. They have trouble, and that can be something as, as complicated as planning a trip to Europe, where you used to be able to do it and now you can't do it anymore. All things being the same otherwise, to not being able to take your medicines appropriately or at the right time or pay your bills, or it's a continuum. But dementia means that people can't live independently. So it sounds like this person does not have dementia. Their mental acuity is good. They can live independently, so they do not have dementia. The question is there a problem? Is there a mild problem, like what we call mild cognitive impairment, which is not dementia, but is not normal?
Right.
So short-term memory, and some people say, doctor, I've always had problems with my short-term memory since I was
right.
But there can be many causes of memory issues. Are you depressed? Could a medication be contributing to this? Do you have sleep apnea and you're not getting restorative sleep? So I would say, yes, you shouldn't be worried, but you should bring that up with your healthcare provider.
And it kind of goes into the same question a little bit, and this will be our last question because we're getting to the 30-minute time. But can I ask my doctor about my memory? Or how can I ask my doctor about my memory? And should I wait for my doctor to bring it up?
Okay, so I'm going to ask the second question first. Should I wait for my doctor to bring it up? And the answer is no. If you have a concern about your memory or about your loved one's memory, you should definitely bring it up with your doctor. And one of the good things to do is to kind of make a list, make a journal. Don't get real carried away, but make a journal of what your concerns are. Mom, ended up 30 miles away when she was supposed to meet me somewhere. Or I'm a journalist and I'm having trouble, completing my assignments, or whatever it is, to be kind of specific with your doctor. And then hopefully your doctor will pay attention and have some time to address that.
Absolutely. And something did come in, and I don't want to not share, because I think it's an important one to share. And that is, we have a new client who's concerned how to approach a diagnosis without her spouse being angry and resentful at her for informing. She worries, how will they leave an upcoming initial neuropsychologist appointment with their dignity intact? Thank you for doing this today. So yes, I do say thank you, but a little bit of thought on that and how to really manage that situation.
Yeah, so it's difficult when we're all in the same room and somebody's tattling or telling things that the other person, the patient, it does not perceive to be true. And so then there's this back and forth. Well, I didn't do that. Well, when did I do that? So either if there's not an opportunity to meet with the doctors separately, then again, I think this journal, this just a letter or a message somehow. I don't want to talk about this in front of mother, but these are my concerns, and have the doctor be informed that he or she needs to read that before you come into the room. And then just to keep things as pleasant as possible. I mean, you don't need to interrogate people and make them embarrassed and frustrated, because nobody's going to do well, whether you have Alzheimer's disease or not. So just to take it easy and feel what's happening in the room and keep things pleasant, and hopefully the neuropsychologist knows how to do that.
Yeah, absolutely. And there, keeping the journal, like you said, is so important. And I always tell people keeping not just a journal of what's going on, but questions to ask the doctor, and even putting a little box that says, okay, I asked that question, I've checked it off. Because remember, we go in with so much information and we can become overwhelmed, and having that journal to ask the questions ahead of time and then ask the doctor and check the box when you found that answer. So it's been such a pleasure having you with us today. And I know I told you all that I would share the 24/7 helpline. It is now showing on our feed here. And so a lot of what we've talked about today and the things that Dr. Steen has answered, we can be supportive to you in our 24/7 helpline. And it is that. It is 24/7. The mention of morning time or afternoon, we also know that this disease does not necessarily rest. So there might be needs in the middle of the night. And that 24/7 helpline is there. And we have more than 200 languages that we can convert to. So, again, before we close out, I just want to say, thank you so much. In the comments, we did post that survey. And it is a requirement for us for what we do is grant funded. And we'd appreciate the feedback. So that survey gives us the information we need, but is also necessary for what we do for a lot of our programs that are grant funded. And again, that helpline number is 800-272-3900. I have it in my phone so that if I ever need it, and then I also recommend people putting it in their phone, because although I have the number memorized, we may not always remember the number, and we may not remember it at the time we desperately need it. So if you are curious about your memory changing and other cognitive changes, please consider joining us on Tuesday, October 27th at 11 a.m. for our virtual Brain Bus live event, our 10 warning signs of Alzheimer's with Kahoot. So it's a game, it's interactive, it's going to be fun. At this program, you'll learn how to recognize common signs of the disease, how to approach someone with memory concerns. You'll learn about the importance of early detection and benefits of diagnosis. And after the program, Kahoot will be played, and it's a fun activity. Again, Dr. Steen, thank you so much for your time, and we appreciate you and everything that you do. We appreciate all of you that joined us today. If we didn't answer your question, you happen to watch this later, do not hesitate to put in comments asking questions, or again, call our 800 number and we'll help the best way possible. Thanks and have a wonderful day. And thank you, Dr. Steen.
Thank you.